Hello, my name's Helen Romness. I am the owner of My Nurse's Life and I am a lead trainer at My Nurse's Life OSCE training company, and I also developed all the training courses and the online and virtual training courses that you can access, and we have a workbook as well for each specialism. So our trainings run weekly in Liverpool and fortnightly in London, and we do weekly virtual training at the weekends. So I just wanted to tell you a little bit about who we are and some of the new services we're offering. We've been offering Resit training to all of our clients and the nurses that come to training for the whole time that we've done OSCE training, and there is a charge for that, but we're now offering it to clients who have maybe used another company and found that they are either not offering OSCE training resitting, or it's very pricey. So please do contact us for more information about that. But I just wanted to give an insight into why we're offering that. The reason why we feel that we're the company that you should go to for Resit training is because we have such a long history of delivering OSCE training to so many candidates, and we have thousands of candidates, and when I say thousands, I mean thousands of candidates that we've got through the OSCE. We've done this for very large NHS trusts, and we still continue to train for NHS trusts, although we do understand that the NHS generally do encourage their own staff now to deliver training. And on that note, we now offer Train the Trainer. Please contact us. This is for NHS trusts that we offer it, if you can understand, not for competitors. So if you are an NHS trust and you can pay through the NHS, we can offer you Train the Trainer. And this has really come about because of, again, just being aware that there are trainers joining the trusts and they're really not understanding the OSCE. It's quite a difficult thing to train now, and this exam's quite tough. The criteria is quite long and it's not always perhaps the way we've been doing it in the hospital. It's slightly different. You have your own protocols and they're just slightly, sometimes just slightly different enough to make the nurse fail. So our training is basically to cover all those bases and to also make you very aware of the patients that you encounter in the OSCE and their scenarios and exactly how they present. So you've done your best, you've tried to interpret these patients and how they might appear from your own clinical knowledge and experience, but we know exactly what is in the OSCE and we know what the fails are. We're lucky enough to work with some examiners who train us up and are always adding to our knowledge and how the marking criteria is weighted. So how that's actually done in reality may be a little bit different to how you're teaching your nurses as well, and how you're assessing them. You may be assessing them too harshly and that might be overwhelming them, or you may not realise how important certain things are for a pass. So we can help you to develop your knowledge and deepen your understanding of the marking process, and that can be done. We have up to 3 days of training on Train the Trainer, and we even can do that one-to-one. It can be done in groups of up to 4 trainers in one session. So if you want to send 4 people from your trust, that's absolutely fine. And just let us know whether it may be that we come to you, but preferably you would come to us, but we could discuss that as an option, us travelling to your trust as well. As I just mentioned a little bit ago in the beginning, we also offer Resit training to all candidates. Now, if you are an individual who's gone to take the OSCE, maybe you didn't have any training and you tried to do it alone, or you relied on YouTube videos, maybe you got some training of some sort, but it wasn't enough. And some, obviously, we've noticed there's a lot of new trainers now about, and these nurses are quite new in this area, and they're often not UK trained nurses anyway. So again, they're interpreting the criteria from their own perspective, and just because they passed the OSCE doesn't make them the expert, and they certainly haven't done years and years of it and have the connections we do with the test centres. So this is the reason why we are now offering Resit training, because we see a lot of people asking us for this. And in the past, I've turned people away, and I'm now making it available to everybody. So if you are struggling with the OSCE, just find out about the OSCE training. If you're a trainer from the NHS and you would like support in any of the specialisms, please contact us and we will be able to guide you from an insider's perspective with the help of ex-examiners who now work for us. And if you are looking for Resit training, either for your candidate or for yourself, again, do come to us and don't leave it too late. You only have 3 attempts at this exam, and then you have to wait 6 months and reapply. So don't leave it too late. Come and ask for help from the experts, and we've kept that at an affordable price for you. And thank you for listening. That's just my message I wanted to get out there.